Hello, my name is Devin. I'm a student nurse practitioner. I'm going to be assessing you today. Today is August 19th, 2022. And I'm going to start by assessing the skin of your face, neck, head, anterior and posterior chest, and your abdomen. I'm going to be assessing for color, temperature, texture, turgor, moisture, lesions, edema, bruising, nevi, and any scarring that you may have, okay? I'm going to go on and touch your head. And I don't see any infestations. Your hair is dark in color. It's evenly distributed. There's no indentations or no masses. Do you have any tenderness?
No.
All right, I'm going to palpate your temporal arteries. Do you have any tenderness?
No.
All right, now I'm going to go on and palpate your lymph nodes. I'm going to start with your preauricular, your postauricular, occipital, submandibular, submental, tonsillar, anterior cervical, posterior cervical, and subclavicular. And did you have any tenderness? And those are all soft and mobile lymph nodes there. And then I'm going to go on and assess you for TMJ. So I'm going to get you to clench your jaw for me. And there was no subluxation or crepitus noted there. And then for your cranial nerve number 5, I'm going to get you to close your eyes for me. And tell me where I'm touching you.
Forehead, right cheek, left cheek, chin, nose.
All right. And then again for cranial nerve number 5, I'm going to get you to clench for me. All right, and that was equal bilaterally, so cranial nerve number 5 is intact. We're going to move on to checking out your ears. Okay. I'm going to pull back up on your pinna and look into there. Your tympanic membrane is intact. Your ear canal has no redness, no discoloration or discharge. Again, same thing on this side. I'm going to pull back and up on your pinna. And tympanic membrane is intact. Your ear canal does not have any discharge, redness, or discoloration, and is free of wax. Your cone of light in your right ear was at 5 p.m. and the cone of light in your left ear was at 7 p.m. We're going to go and check cranial nerve number 8. I'm going to start with the whisper test. I'm going to get you to cover your right ear.
Car,
House. Fish.
fish,
All right, and cover your left ear. Socks.
socks, pants,
Shirt.
shirt.
Okay, so you do have gross hearing in both ears. All right, and then we're going to move on to the Weber test. So this is going to tell me if you have one-sided or unilateral hearing loss, and tell me, is it equal?
It's equal.
Okay, so that tells me that you do not have unilateral hearing loss. I'm going to place this by your ear and tell me when the sound stops, okay?
Stop. Stop.
All right, so in your right ear, your air conduction is greater than bone conduction. And here,
Stop. Stop.
and your left ear, your air conduction is greater than bone conduction as well. All right, so when I'm just looking at your eyes, I can tell that your eyelashes and eyebrows are evenly distributed, and there's no signs of infestations. Your palpebral fissure is the appropriate height and width for your age. And while I'm also looking, I'm going to go on and palpate your ears. Do you have any tenderness? Okay, good. All right, so back to your eyes. I'm going to have you look up. Your sclera is white. Your conjunctiva is pink, moist and intact with no lesions or discharge noted. And I'm going to start with I'm going to move on to cranial nerve number 2, which is your central and peripheral vision and your gross visual acuity. So I'm going to have you look at that card for me and read that line with your right eye covered.
DHGVS.
All right, and with your left eye covered.
DHGVS.
All right, and then with both eyes.
DHGVS.
Okay, perfect. So that tells me that cranial nerve number 2 is intact for your gross visual acuity and central vision. Now, to finish that cranial nerve, I'm going to check your peripheral vision.
I can see it. I can see it.
All right, so your peripheral vision is intact. While you're going to sit now, I'm going to go on and check your cranial nerves number 3, 4, and 6, which is conjugate gaze and extraocular movements. So follow my finger. Those movements are symmetrical and smooth without extraocular movements noted. And then follow my finger in. All right, so that you did have accommodation and convergence. Your pupils did respond when my hand came to your face, so that is intact as well. All right, now we're going to move to cranial nerve number 3, which is your light accommodation. And look straight ahead. All right, so you did have pupillary response both directly and indirectly from 5 millimeters to 2 or 3 millimeters bilaterally, and so that tells me that cranial nerve number 3 is intact. Okay, so now we're going to move on to your sinuses and nose. Your frontal sinuses and maxillary sinuses. Do you have any tenderness?
No.
And I did not feel any warmth. All right, your nose is midline and straight, as is your head is midline and straight. And go on and breathe out of one of your noses for me. And the other. And then, I'm gonna get you to smell this for me. What does it smell like?
Coffee.
Okay, so cranial nerve number 1, since the smell is intact. And then I'm going to get you to open your mouth for me. I'm gonna look inside your mouth. All right, and say ah. All right, so it looks like your cranial nerve 9 and 10 are intact. Stick your tongue out. Cranial nerve number 12 is intact, and 9 and 10, you can close your mouth. 9 and 10 is intact because your uvula and soft palate rise with pronation, and 12 is intact because your tongue is straight, midline, and free of fasciculations, okay? I'm gonna look inside your mouth one more time. It does look like your teeth are straight and evenly aligned. They're shiny and white in color. The tongue, floor of your mouth, roof of your mouth, soft palate, posterior pharynx, and buccal mucosa, all of that are pink and moist and intact. You don't have any tonsils. All right, so next I'm gonna check cranial nerve number 7. I'm gonna get you to smile. Puff your cheeks. Frown. All right, poke your lips out. And raise your eyebrows. All right, so cranial nerve number 7 is intact. All right, so I think that kind of completes that part of the assessment. I'm going to go on and move on to assessing your back. So I'm going to get you to sit up for me. And I do notice that your posterior chest is free from obvious deformities. There's no retractions, no ancillary accessory muscles, no tripod positioning. There's no cyanosis, no discoloration, no tachypnea or difficulty breathing noted. So your respiratory status is generally intact. I'm going to palpate for symmetrical chest expansion, so I'm going to get you to take a deep breath and let it out. All right, so you did have symmetrical chest expansion. I'm going to palpate for tactile firmitis and say 99.
99, 99, 99, 99, 99, 99.
All right, and the vibration was equal bilaterally, so your tactile firmitis is equal. I'm going to go in and percuss your in between your intercostal spaces of your back. And that sound is resonant in all quadrants that that I assess. While I'm back here, I'm also going to percuss your costovertebral tenderness. Any tenderness? No. Any tenderness? No. Perfect. All right. Now I'm going to give your chest a listen. I'm going to start with just your regular lung sounds, and you can breathe normally for me, okay? Right quadrant over here, and your lung sounds are clear with no adventitious lung sounds noted. All right, now we're going to start with egophony. I'm going to get you to say E for me when you feel my stethoscope.
E, 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 E.
And that did sound like E, not A, so there's no consolidation. Now we're going to move on to bronchophony. Say 99.
99, 99, 99, 99, 99, 99.
And that 99 was indistinct, so that tells me you have no consolidation. Lastly, it's going to be whisper peptowilliquy. And then I'm going to go on and get you to say 1, 2, 3 when you feel my stethoscope.
1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3.
All right, and that was indistinct as well, so that tells me that you do not have any consolidation. And that completes our posterior chest assessment. We're going to go to our anterior chest where we don't see any obvious signs of respiratory distress, and our abdomen is round and contoured with no masses. Okay, and so the next thing I'm going to do is I'm going to palpate your trachea. Your trachea is midline, and then I'm going to go in and palpate your thyroid. Okay, so I'm going to get you to swallow and swallow, and your thyroid was soft and mobile, and it did move slightly with swallowing, so that's really good. Now I'm going to palpate your carotid on both sides, and that was +2, and that was good. And then I'm going to auscultate for bruits on that carotid as well. And there was no bruits noted with the auscultation on that carotid. So now we're going to go back to our respiratory assessment, and I'm going to just assess your lung sounds on the front. Breathe normally. All right, No adventitious lung sounds noted, and all fields were clear. All right, now I'm going to palpate for symmetrical chest expansion. Okay, and take a deep breath. And that is symmetrical. And when you feel the palm of my hand, say 99.
99, 99, 99, 99, 99.
All right, and the palpation of vibration was equal in all areas, so that tactile harmonics assessment was normal as well. All right, I'm going to go on and listen to your heart now. I'm going to start on the right sternal border at the second intercostal space for your pulmonic, and then the left sternal border on that second intercostal space for your, right sternal border, second intercostal space for aortic, and then left sternal border, second intercostal space for pulmonic, left sternal border, third intercostal space for Erb's point, left sternal border, fourth intercostal space for tricuspid, and then the fifth intercostal space at the midclavicular point for your mitral. And that was heart sounds S1 and S2 were heard. There were no rubs or S3 or S4, murmurs or anything noted. Now I'm going to listen with the bell of my stethoscope in reverse for mitral, tricuspid, Erb's point, pulmonic, aortic, and I didn't hear any heart murmurs, bruits, or thrills on that. And then I'm going to go and listen to, before we move on, for 1 full minute of your apical pulse. And that apical pulse is 89 beats per minute with a normal rate and rhythm. I'm going to palpate your point of maximum impact, which is at the midclavicular space about the fifth intercostal. And there's no bruits or thrills palpated on that. All right, I think we're ready to get you to lay down. So lean you back a little bit. All right. Are you comfortable? All right, there's no heaves and lifts noted in this patient when they lay back. And I'm going to check their jugular vein for distension, so turn your head slightly right. All right, and that's 2.5 centimeters from that sternal angle on this person, so that is a normal finding. All right. I did notice again, there's no heaves and lifts. Our abdomen is contoured, round, and no masses. And I'm going to repeat my cardiac assessment with the diaphragm of my stethoscope for aortic, pulmonic, Erb's point, tricuspid, mitral. And there was no, those heart sounds were normal still, S1 and S3 with no extra heart sounds or murmurs noted. Now I'm going to palpate those points, aortic, pulmonic, Erb's point, tricuspid, and mitral. And on palpation, there was no bruit or thrills palpated. All right. Now I'm going to move on to our abdomen assessment. And I'm going to start by listening to our bowel sounds. I'm going to start in the lower right quadrant. And the bowel sounds are normal active in all quadrants. So I'm going to flip over to use the bell of my stethoscope. And I'm going to listen for bruits to his arteries in his abdomen. I'm going to start with aortic. And then renal, iliac, and femoral. And there was no bruits noted on that assessment either. All right. So now I'm going to go on and palpate his abdomen. Did you have any tenderness? Okay. I'm going to percuss. And that was tympanic with no dullness noted on the abdomen. Okay, I think we're ready to sit now. So, okay. And then when we sit up, I'm going to go on and assess for his hand. Let me see your hand, please. And I'm going to palpate for crepitus, nodules, obvious deformities in his hands, wrists, elbows, and shoulders. And none of that was noted. Did you have any tenderness? All right, we're going to do a range of motion in our fingers. We're going to flex those fingers, extend them, hyperextend them, abduct them, adduct them, and then thumb opposition. We have full range of motion in our hands. Wrist is flex, extend, hyperextend, rotation, and then radial deviation, and then ulnar deviation, and that's positive as well. All right, I'm gonna also now check for our cerebellar coordination. So I'm gonna have you flip your hand like this for me, and the other one, and then finger opposition, and then touch my finger with your right hand as fast as you can. All right, and left hand. Okay, so your cerebellar is intact as well. All right, so now we're gonna do the range of motion of the elbows. I'm gonna get you to flex your elbows, extend them, hyperextend them, all right, and then the shoulders, we're gonna do this. That's gonna tell me internal and external rotation. All right, and then circumduction, extension, hyperextension, and then flexion. Okay. And then we're also gonna check cranial nerve 11 while we're working on your shoulders. I'm gonna get you to shrug against me. All right, and that tells me cranial nerve number 11 is intact. And then I'm gonna check the strength of your shoulders. So I'm gonna get you to bend your elbows for me. Bend your elbows for me, like that on both sides. And pick it up against me. And pull down against me. Okay, so that's 5 out of 5 strength. They're gonna squeeze my fingers for me. All right, 5 out of strength in both hands, arms like this. All right. And 5 out of 5 strength in biceps and triceps. Okay, and I'm also noting that on this assessment, his upper and lower body, his skin is warm, dry, and intact. There's no discolorations, no edema, no lesions or anything noted. I'm gonna get you to close your eyes for me and tell me where I'm touching.
Right arm, left arm, right leg, left leg, right leg, left leg, right feet, left foot.
Okay, so he does have his sensation intact as well. Alrighty, now I'm going to get you to close your eyes for me. And I'm going to put something in this hand and tell me what it is.
Icon,
Okay? And then I'm going to put something in the other hand and tell me what that is.
a paper.
Okay? And so what that tells me is that your sterignosis is intact. And then I'm going to get you to close your eyes again and then tell me what I'm writing in your hand.
D.
And then,
A.
alright, perfect. Now we are going to circle back really quick and I'm going to get you to tell me to check your cranial nerve number 1 and tell me what this smells like.
Coffee.
Alright, so cranial nerve number 1 is intact. Okay, so we talked about that. I need to check your capillary refill in your hands. So let me see those. Alright. Capillary refill is less than 3 seconds. And then I'm going to go and check his radial pulses bilaterally. And they are equal bilaterally on both sides. Alright, now we're going to move on to the tendon reflexes. And we're going to go with this right hand first, and we're going to start with the brachioradialis. And that response is +2 in brisk. And then the bicep. And that's +2 in brisk, and the tricep. +2 in brisk. On the other side, the same thing. Brachioradialis, bicep, and tricep, and all 3 of those were +2 in brisk. Now we're going to move on to the patellar. I'm going to pick that up a little bit. All right. The patellar was +2 in brisk, and the other side. And that's +2 in brisk as well. All right, now we're going to move to the Achilles. So I'm going to get you to rest your foot in my hand. Alright, that's +2 in brisk, and then this side. Alright, and that's +2 in brisk. Next, I'm going to check your Babinski. I'm going to run this up the bottom of your foot, and the toes did not fan out. And the toes did not fan out, so that tells me we have a negative Babinski reflex. Alrighty. So the next thing we're going to do is I'm going to go in and assess his toes and ankles and knees and then his hips. And those are no obvious deformities, no crepitus, no nodules noted. Did you have any tenderness? Okay. And our capillary refill in our toes is less than 3 seconds. And the dorsalis pedis on both sides is going to be +2. And then the posterior tibialis on the left is +2. And on the right is +2 as well. Alright, So we're gonna move on to the range of motion in our toes. I'm gonna get you to flex your toes, extend them, hyperextend them, abduct them, adduct them. We have full range of motion in our toes. All right, with our ankles, we're going to plantar flex, dorsiflex, everge, exverge, and then rotate. We have full range of motion there. And I'm going to go in and check the strength here. I'm going to raise up against my hands. All right, and then push down. 5 out of 5 strength there with the knees. Push, full. 5 out of 5 strength there, and then the hips. Push and push. 5 out of 5 strength in the hips. All right, I think the next thing we're going to do is stand up. You want to stand up for me? Okay, and so the first thing we're going to start with is the range of motion in our knees. So we're going to flex, extend, hyperextend, and then the other one. Flex, extend, hyperextend. We have full range of motion in our knees. We're going to move on to your back now. I'm going to go and have you flex your lumbar spine, extend your lumbar spine, hyperextend your lumbar spine. All right, and then rotate your lumbar spine the other way. Okay, and then lateral flex your lumbar spine and the other way. So we have full range of motion there. All right, now we're going to work on your cervical spine. And so I'm going to go and have you rotate that, both sides. Okay, and then flex, extend, hyperextend, and then lateral and lateral. So you have full range of motion there. I'm going to get you to turn around and face the wall for me, please, sir. Okay, and bend over and touch your toes. And rise up slowly, please. Okay, so your spine does have a normal curvature. Did you have any tenderness? There was no nodules, no crepitus or anything noted, so that does tell me you don't. And there's no obvious scoliosis. All right, so now we're going to move on to your hips. I'm going to get you to turn back and face the camera again. And then what we're going to do with your hips is we're going to laterally flex those on both sides. All right, we're going to circumduct those on both sides. And then we're going to flex them this way, extend them, and then hyperextend it. Oh, all right, and then the other side too. Not so much, maybe. All right, and then there you go. All right. All right, now you're going to stand with your feet together and arms out. And that's a negative Romberg test. And so I'm going to go and get you to rest your arms back down by your side. And I'm going to get you to walk towards the camera normally. All right, and turn around and walk towards me, heel to toe. All right, and so all right, turn back around, look at the camera for me. So you do have a steady gait, both normal and in tandem. Let's see, I just want to go over everything, make sure I got everything real quick. Yeah, that completes our assessment today. Thank you very much for your time.